Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. Today we will discuss about a familiar respiratory therapy device which is commonly used to promote lung expansion and prevent post-operative pulmonary complications by encouraging patients to perform slow, deep inspirations and providing visual feedback to motivate effective breathing efforts. Yes, it is spirometer. Let's start today's discussion. So what is spirometer? It is a goal-oriented lung exerciser that is based on the technique of sustaining maximum inspiration, and it enables the patient to exercise his or her lungs without any stress. And this spirometer is designed to mimic natural sighing or yawning by encouraging the patient to take long, slow, deep breaths while visually examining his or her progress. In previous slide, it is mentioned that spirometer is based on the technique of sustaining maximum inspiration. Now we have to know what is this sustaining maximum inspiration. It is one of the techniques used to improve the lung performance in conditions where lung functions are compromised due to various respiratory disorders like atelectasis or bronchial asthma, etc. And the essential of this technique is to increase lung expansion in a graded manner, which in turn leads to reduction of unwanted secretions and metabolites. And this also improves the muscular tone of the thoracic area and ultimately leading to an improvement in lung function. Next, coming to the benefits of spirometer. It helps in teaching the patient to take long, sustained and deep breaths. It helps in achieving maximum lung expansion and strengthening the cough effort, which helps in maintaining clear airway. It is made of single molded transparent chamber. Hence, it prevents any air leakage, thus providing correct visual examination. And it helps in maintaining bronchial hygiene and avoids infection as it can be dismantled and cleaned thoroughly. Let's see the instructions for use so that we can instruct our patient how to use this spirometer. First, sit up straight or lean forward. Then hold the spirometer in an upright position and breathe out normally. Then place the mouthpiece in mouth. Seal lips around the mouthpiece tightly and breathe in slowly and deeply with lips sealed tightly on the mouthpiece. Next, after deep inhalation, hold breath for at least 3 seconds. And if you can hold up to 10 seconds. This will cause the red ball in the first chamber to rise, thus indicating the inspired volume. And consequently, with further increase on inspired volume, the yellow ball in the second chamber and the blue ball in the third chamber will rise too. Then remove mouthpiece from mouth and breathe out normally. Repeat this technique 10 to 15 times and continue inhaling and lifting all 3 balls if possible. Next, coming to the cleaning instructions, and cleaning is recommended after every 3 use of spirometer, and we can dismantled the parts of spirometer and we can clean it with normal soap and water. Let's know how we can calculate the inspired volume when the patient is exercising with spirometer. If red ball is kept afloat for 1 second, the inspired volume is approximately 600 cc. And if both red and yellow ball are kept afloat for 1 second, the inspired volume is approximately 900 cc. And if all the three balls are kept afloat for 1 second, the inspired volume is approximately 1200 cc. So this is about spirometer. And if this content is useful for you, then please put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel NG's Corner for nurses. And for any queries or for any suggestions, you are most welcome to comment. Thank you for watching.